Good evening to all our distinguished participants, estimated speakers, and organizer of the AICTE sponsor ATAL Faculty Development Program. It gives me immense pleasure to welcome you to Technical Session 9, which will shed light on an incredibly innovative and impactful topic, development of newer medical system for dental implants. Dental implants are cornerstone of modern dentistry, and with continuous advancement in medical system, this field is evolving rapidly, offering more precise, efficient, and patient-friendly solution. Today, we will explore how cutting-edge research and innovation are driving the development of newer medical system for dental implants, revolutionizing the dental healthcare landscape. To guide us through this engaging session, we are honored to have with us Dr. Harish, a renowned expert and visionary in the field of medical system development for dental applications. Dr. Rathi is a distinguished academician and researcher with an extensive background in developing innovative medical systems. His expertise spans across the biomedical engineering, dental system optimization, and advanced healthcare technologies. With a passion for creating impactful solutions, Dr. Rathi has significantly contributed to bridging the gap between medical sciences and engineering, lead to practical and effective outcomes in the dental healthcare. Over the years of experience, Dr. Rathi has worked on numerous research projects, collaborated with industry leaders, and published high-impact research papers in reputed SCI, Scopus, and conferences. This work has been instrumental in advancing dental implant technology and improving patient care. Dr. Rathi's dedication and contribution to the field are truly admirable, and we are fortunate to have him share his insight and expertise with us today. Let us welcome Dr. Harish Rathi and Dr. Nakul Rathi to take the stage and share this knowledge of his fascinating topic. Over to you, sir.
Thank you, sir, for a very nice introductions, and it's really my pleasure to speak on 3D printing and development of newer medical system for dental implant. Then dental implants is one of the latest innovations in dentistry, maybe around 50 years back or so started. What is a dental implant? Dental implant is generally what you can say that it's a small screw which mimic the roots of the tooth and serve the purpose of root of the tooth. Dental implant is the latest thing, and it replaces the tooth, because on the implant you have to put the crown, and it is the use in the mouth. Then dental implant is a need, because all over the world there are so many, say more than 800 crores of the people, and everybody is having almost 32 teeth, and teeth are vulnerable for many things like chewing, accidents, and fracture while chewing abrases the teeth also. So teeth are very vulnerable for so many things. So the teeth get damaged, and need of replacement is very much needed. Fortunately, there are 32 teeth. So actually, we have the lot of numbers of the teeth which can be repaired or replaced or something like that. And dental implant is one of the latest things which replaces your natural tooth and very close to a natural tooth. In the olden days, instead of when there was not dental implants, partial denture made of acrylics, and which we were used in a mouth, and it was stable with the help of some acrylic plates and all these things was used. So partial denture, then came the fixed partial denture also, Then came the dentures. When all the teeth are not there, you need a full mouth rehabilitations, and that is done by the dentures. But all these removable dentures are slightly mobile in a mouth, so they are not very comfortable, and the chewing capacity is also quite less. Then came the fixed teeth, that is crown and bridges, fixed metallic crown and bridges. They are covered with the ceramic layering, and the teeth crown and bridge also. When there are some teeth in a mouth, with the support of these teeth, you can prepare the crown and bridge. When the implant is there, you can just, that is a small screw. The screw size is, say, from 3 millimeter diameter to maximum diameter to height 3 to 5 millimeter diameter to the height of about 6 mm to 12 mm, 13 mm. Sometimes nowadays different implants are available which are up to 25 or 40 millimeters also long. So this is a very small screw actually, and this screw is mainly made up of titanium alloy, and it is embedded in the body. As a titanium is a biocompatible material. Our bone get osseointegrate with these screws, and these screws serve the purpose of dental implant, on which we can give the crowns. When there is a one tooth is not there, like we can go with a single tooth implant, and when there are many teeth are not there, so we need to with many implants, maybe 2, 3, 4. When all teeth are not there, we need 5 to 6 to 8 or 10 implants, and on that implants we can fix our prosthesis. And that prosthesis is like a crown of teeth, which gives all the function of the natural tooth. So I will just give. So this is a parts of dental implant. Actually, one is a root, and then above that there is a abutment, what we say, and then crown. So this is all about parts of dental implant.
Can we go to the next slide?
This is next slide. There we have given a systematic one single tooth implant, teeth, double implant. Then on that tooth we can fix, and even a full mouth implant. And when the implants are fixed, they are fixed in a bone. So we have to plan what should be the angulation of the implant, and that planning can be nowadays done with the help of CBCT. CBCT means bone-beam computed technology that offers precise 3D imaging of the patient's oral cavity, including bone density, nerve pathways, and sinus location. This data ensures that the implant is placed in an optimum position, reducing the risk of nerve damage and implant failure. So this is all. Nowadays implants can be planned. Replacing the implants can be planned with CBCT or maybe a CT scan. Because of this, your precisions and precision has been improved, and improved treatment planning with very less complications. Because of the CBCT and use of 3D technology, less invasive techniques, minimally invasive techniques we can use in putting the implants. Even we can put the implant with the flapless surgery. Flapless surgery instead of giving a total cut and opening the bone, we can do the very small hole in a gum and we can put the implant. Then guided surgery also can be done. Here we prepare the total guide, 3D printed guide of acrylic material we prepared, and we use that guide, and guide gives very exact precisions to put the implant in an optimum placement with optimum base angulations and base position, and it reduces the time of surgery also. There are nowadays many materials we are using in implants, like zirconia implants, and then titanium implants. Then there are again the surfaces of the implants are modified by different materials, and even a sandblasting, acid etching, and nanotechnology to create the texture surface, which gives a better osseointegration of the implant to the bone and gives the faster healing also. Bone grafts and biomimetics is used to build the bone if bone is less. New biomaterial like bioactive glass and calcium phosphate stimulates natural bone growth also. Elimination of need of that eliminates the need of donor bone in many cases. Many growth factors are used while preparing the implants also. Even nowadays, smart implants are also coming with the sensor integration. The smart implants embedded with tiny sensors can monitor conditions like stress, temperature, and infection at the implant site. And the data can be used by dentists for more care. Even implants can be covered with some drug delivery systems, which can give the better enhancement of better osseointegration.
So yeah, just to add one more point, sir, there are implants nowadays which are dental in nature, but there is research going on to show that those can be used for auditory function as well. So our maxilla is connected directly to the base of the skull, and like there are appliances and devices that are used that through vibration you can hear, you can make sounds being felt, and there is research going on to use dental implants for an auditory enhancement function, just like the smart implant that was mentioned. So just to add on to that point.
But with bioengineering in implants design, nowadays implantology has changed to immediate implants. Means you put the implants and immediately you give the teeth on the implant. Because traditionally implants takes 3 to 4 months for healing, but nowadays there are certain new advances are there which can make the implants loading immediately possible, so that reduces the patient treatment time, and the things can be happened in a single visit also. Just I have the one model. This is a model with the teeth. This is the model with the teeth 3D printed before for study. On the model itself, we removed all the teeth virtually, and we prepared the surgical guide for the patient. And with surgical guide, we put the implants in the patient's body, and this is on implants. This is known as all-on-4 implant systems. There are only 4 implants in the upper jaw, and lower jaw also 4 implants. And then this 4 implants we put one bar, which is a customized 3D printed bar. And on this bar, this bar is fixed to the implant. So implant also becomes printed, non-movable, you can say. And on this bar, then we give the individual teeth. So like this, all these systems, because of CBCT, because of so many different CAD/CAM software and CAD/CAM printing and CAD/CAM milling systems, we are able to give the total implants in one day. So we start the patient in the morning, and within 5-6 hours, we can give him a total teeth in his mouth. And all these things can be prioritized, and we can decide data and everything. From CBCT, we can take some data we can, because with CBCT, we get the total bone curvatures and everything. Then from interval, we have the interval scan system. So there we get all the soft tissues, and then we prepare the face scan also. And all these scans can be integrated, and we can plan all the treatments very nicely, and we can give the best dental solution to the individual. History of 3D printing in dental implants started, say, in 1980. So Dr. Charles Hull, he was inventors, and stereolithography SLA system he that time was used to get the precise printing for the implants. In 90s, adoptions of 3D printing in healthcare began. In 2000, you can say the more materials, biocompatible metals and ceramics has come up with dental implants, and some surface coating of SLA and then even a 3D printing with DLP become the preferred method of dental application. Emergence of more accessible and compact 3D printers tailored to dental clinics and labs, integration of CAD/CAM system facilitating chairside manufacturing also. Widespread use of high-speed multi-material printers enabling direct manufacturing of crown and surgical guides has made the 3D printing and in dentistry very wide. Nowadays, biocompatible wedges for temporary crown, wedges, and surgical guides we are using. There are some titanium, cobalt alloy, and there are many metal alloys available, which can be printed also, which can be milled also, and different dental implant systems can be prepared. 3D printing application of surgical phase of this is the total how we do the 3D printing and all. There are like surgical guides are prepared, then bone graft and scaffolding. Sometimes titanium mesh also we prepared and used for the dentistry. Dental implants, there are many fixtures, say more than 2,000, 3,000 fixtures are there on dental implants, because every individual has a different jaw, different curvature, different bone density, and for that we need a different fixtures, and even aesthetic wise also everybody has a different requirement. So dental fixtures are in abundance, say maybe thousands, and if we can get it 3D printed, we can make according to the patient's requirement, individualize the all printing of the dental implant fixtures, which can give the better results. Even sometimes dental implants also we can manufacture patient specific, what we say the patient specific dental implants, and it can be used for implants implants and implant prosthesis. There are different printing methods also, like stereolithography, selected laser melting, fuse deposition modeling, polyjet technology, DLP printing. So these are actually you are the people from the same field, so you know better. Designing and printing of software. There are some softwares which have really made the life very easy by designing different things for CAD/CAM. These are like ExoCAD is one of the very widely used. Then 3Shape Systems, Densplice, Sirona, Blue Sky Bio. These are some of the companies which have the CAD/CAM software. These can be used, and we can prepare the different designs on what are the like on CBCT or interval scan and face scan. On that, the software prepare the different designs, and these designs can be sometime if we are doing 3D printing. There are certain slicers, printing slicers. That's there are like Mimic and Dental Wings. These are some of the softwares which can be used for designing the different prostheses. This 3D printing in dental implants, because of high-speed 3D printer, hybrid machines, then because of software, some personalized solution, and remote accessibility has become a boon for using the and preparing the dental implants in the clinics and for the patients. Application of 3D printing, like preparing the crown and then dentures, aligners, some brackets, surgical guides, models, and prototypes for study. This is a picture you can see where nowadays implants, like what we say the subperiosteal implantology, when the bone is very less, without surgery, we take this say CT scan of the patient, and on the CT scan with the help of some software, we prepare the total design, and we reflect the flaps, put the metal structures exactly on the bone, screw it, and then on that we prepare the prosthesis and give it to the patient. The things can be done in one day also. For education purpose also, we use a lot of 3D printed material. This is one of the jaw, and which mimic just like a patient, and and study can be done. By the future of 3D printing in dentistry, this is bioprinting is nowadays it becomes possible, and because of that we can prepare the personalized appliance, including implants and of superstructure also. Then there are many input material, and the only thing is what we need today is a reduction in cost for patient. As technology become more widespread and efficient, this will be definitely there, because there is a very wide scale applications of dental implants and printing is there, because there is a lot of populations who has no teeth, and if we can give them affordable teeth, they will definitely affordable, good, comfortable, and while doing also, if it is very easy to do from patient point of view, from doctor point of view, there is a very vast scope for going for manufacturing, for doing dental implants. So if the dental implants and all technology improves, there will be, everybody will have all 32 teeth lifelong. Everybody will have up to the last teeth in his mouth for chewing. Again, there are so many AI-driven tools can be used for especially the designing of the implants and implant structure. Then integration of AI and imaging technologies for precise and automatic detection of dental issues can be done. Enhanced treatment planning, AI-based can be done. That will reduce the error also. And materials and remote collaboration, different materials and remote collaboration is possible through all latest technology, which can take the technology to the new height with the help of collaboration of all the world people.
So just, I think a lot of the slides that that are going to come in, I also have a additional clinical presentations of a few of the situations which have been described. And let me quickly introduce myself before starting to talk. I'm Dr. Nakul Rathi. I'm Dr. Harish Rathi's son, and I'm practicing. I'm a practicing dentist in US, and I will share my experience of the technology that we are using in dentistry right now in US and India both. And what I feel that a collaboration between the engineering field and the field of dentistry, which is an extension of bioengineering. A lot of things that we use in dentistry now are very dependent on the improved technology that has happened through the field of growth in, say, CAD, CAM, or 3D printing. And I'll just, I know most of the listeners today are faculty and engineers, and I have been lucky to be a part of the Raisoni Institute's CAD CAM program. We've had at least 6 postgraduate students who've done dental projects with us in Nagpur, and through the collaboration that we've had with them from US. So I wanted to shed a little more light and see what more collaborative things we could do because of these advances. So I think this I'll present my screen and see if screen to is my screen visible, sir?
Yes, sir.
No, sir.
Share. Is it visible now?
Yes, sir.
Okay, great.
Now the page is loading.
Yeah.
Yes, sir. Screen is shared.
Screen is shared, right? Yeah. So I will. So most of the things that Papa just showed regarding what we are doing nowadays with 3D printing and with AI and with software, I think in dentistry, a lot of this is being used. So just to give you an example of a few cases here, we are really using AI and face scanning to be able to achieve clinical results for our patients. Here you can see a 3D model of a CT scan so that a dentist can very easily plan the surgery. On the right here, this one, can you see my mouse as well, or is the mouse not visible?
Mouse is visible.
Okay, yeah,
And
so
all
I
the
can use
pictures,
the mouse.
yes, sir. All the pictures are also visible, clear.
Okay, so I'm just using the mouse as a pointer for me.
Okay, okay, sir.
So here you can see here you can see how we are able to really design the teeth for the patient that is missing all the teeth on the CAD/CAM software, and then eventually using that design to 3D print or to mill teeth. So a lot of engineering is actually happening at the background to deliver the kind of care that we want to deliver to our patients. This is just me. I'm a graduate from Government Dental College and Hospital Nagpur, and then I did my master's at Ohio State University, and I'm currently working in Houston, Texas. But this is what I wanted to show you. Like, there are real life changes that are brought because of the impact of engineering being implemented in dentistry, right? And there is fairly straightforward process that has been established already, where what I'll do is initially I'll tell you the direct 3D printing applications of prosthesis and implants, and why I think that it is at the cusp of really becoming mainstream, because the cost and the reach of this technology has become a little more widespread. So the process of making any appliance in dentistry with the current technology that we have involves, I would say, these factors of fabrication of the processes. But before fabrication, we have to get the design, and before the design, we have to acquire the data from the patient. So these 3 steps are involved. From a printing standpoint, which I thought we were talking a little more about printing, but I'll also discuss a little more about designing. I think when the topic was mentioned, I think adding design factor would be a good thing for new engineering people to help us in the profession of dentistry. I think the help that we need from the technology side is both at the manufacturing front and at the designing front. So from the manufacturing standpoint, right now, I don't want to explain 3D printing to you guys because you probably know about it. But in dentistry right now, these are the 4 different types of 3D printing technologies that are being used. FDM being the most common one. We generally make we make dentures. बत्ती सी जिसको हम बोलते हैं, बत्ती सी patient की flexible material dentures are made through FDM technology routinely. SLA is also used, and I'll give you a few examples. Like you can see here, this is a built plate. This is the resin tank. And this is a machine that is in my clinic here, and we use it almost every day to make new teeth for our patients, right? This is a liquid resin bath. This is the resin tray on which the prostheses are getting printed. The steps involved to make this is, first we acquire the data from the patient through a 3D scanner. We import that into some sort of a design software. Once that data is imported into some sort of a design software, then we push it into mostly a 3D printer nowadays, but you can put it into a milling machine as well to do the 3-dimensional milling of the object. Once it's printed or milled, generally the file needs to be modified or altered a little bit using the post-processing steps, and then is the finishing. So these are generally the 4 of the 5 steps that are involved in any implant or prosthesis that we manufacture. By implant, I also generally the term implant is used when it's going inside the body. A lot of the prostheses that we print are going on the body and not in the body. So there's a slight difference. But we can follow kind of the same process for implantable devices as well. Just as an example, I wanted to show, like this is a printed model of the patient's skull, and this is a 3D printed I don't know whether it's visible or not. If this is a 3D printed titanium frame, and this was actually made by a company in Nagpur itself. There's a company called Lucid that came out of VNIT graduates and a professor at Vardha Dental College, and they are doing it. The company is called Lucid. So a lot of these technology which we thought were more impractical are actually becoming everyday usable tools for clinicians like us to deliver the right kind of treatment for our patients so that we can really achieve the kind of results that I showed you, where we are changing the smiles and the lives of the patient. Right. So in the clinical setting, just to show you how steps go when we are fabricating anything 3D printed. So what we have to first do is the patient comes in the office, we take a scan. When we take a scan, we get a data which is similar to this. We get a data, we take the scan of the patient and we get data which is similar to this. Once we have acquired this data, we send it to a software to design whatever appliance we want to design. Now, Dr. Rathi was discussing about different CAD softwares, and I think that is one area of technology that we need a lot of development in. I think there are softwares that are available, ExoCAD, but these are all very expensive softwares. And for this technology to really reach the level of care for every individual in the world, I think the technology needs to get a little more affordable. This technology has been present for about 20, 30 years now. So I think it's time for it to become more approachable for the masses. And so we can deliver care to more patients. But essentially, these are very simple CAD software, computer-aided design softwares. I know a lot of colleagues of mine using free versions of these softwares as well, like Mesh Mixer, which is from Autodesk. Simple free softwares as well to design teeth and to design patients' dentures. Now, the disadvantage of the free ones is the tools are a lot more harder to use, but this is a space which is going to gain a lot of traction and interest. There are companies that are working. There's a company out of Bombay by Dr. Neeraj Roida. There are a few other companies that are working in the process of making this a little more approachable, but there's a lot more scope on the design aspect, especially after the advent of AI. A lot of the designing is actually being done by artificial intelligence, because although every design for every patient is customized, it is individually designed, but the parameters remain fairly well defined. That say the teeth will be about 10 millimeter long and 8 millimeters wide, and this will be the shape. If you have an adjacent teeth, you have to match it. So the parameters are very are trainable to the system, and there are companies trying to figure out the AI applications in the design aspect of dentistry. And that's where I think a lot of work could be done for the next 3 to 5 years, where instead of us in India being the adopters of technology, we can really be the developers of this new change that's happening in the technology from a software standpoint, for sure. Okay, so See, once the prosthesis gets designed, what we do is we use different types of resins. Most of the regular applied resins in dentistry now are in the liquid or flowable form. We pour it into a 3D printer and we make devices from that. A lot of this 3D printing, at least in the developed world right now, has gone chair side, which means that the printing is happening right with the patient. In Nagpur as well, I know we are using 3D printing in the clinic. So I would really encourage anybody who's interested to learn more about this and wants to do more work in this space. We can collaborate and do more things which are cutting edge and develop new techniques and new workflows and products with this. So once the design of the prosthesis is done, we select the resin, we select the printer, then we do a step called nesting, where whatever STL file was designed gets nested on the platform of the printer that we are going to use, and we start 3D printing. Generally, when the prints come out, they have these supports. They have these supports of the print. So we have to clean those supports. We have to remove all the uncured resin and do post processing and final cure. Most of the resins that we are using only get cured between 40 to 70% in the printer. The final cure is happening outside in a separate post processing curing unit. That helps us making the prosthesis faster as well, and we can and the cost also significantly reduces because of this. Once this curing and final thing has been done, we can actually just do quality testing and test it in the patient's mouth. So I'll give you, so these dentures have been simply 3D printed, right? And there are really so denture is one of the most simplest example, but we can make implant crowns, we can make implants, we can make a lot of different types of these prostheses and implantable devices through this technology. So I think the place where we have a lot of different scopes of research that we can do is at the software side of this technology, the hardware side of the fabrication, and the third thing that I think would be the material side. There are at least 3 companies in India that have US FDA approval for the type of 3D printed material. There's a company out of Pune called DTech that manufactures these resins. There's a company from Jammu it's called Prevest, which makes these 3D printed materials. So I think so we can categorize the development based on software, based on hardware, and based on material, where we can use engineering support and engineering help to make these processes and these workflows and these treatments more approachable and more relevant for our patients. So just to explain printers that we are using in a little more detail, this printer is a printer that I use. This is out of Taiwan, made by our Indian founder, Ayush Bagla, where what we are doing normally is it's a liquid resin bath. The light source is from the base. The tray has a clear platform, and the print of the prosthetic gets done on the platform upside down. The z-axis, the z-axis of the printer is right here, where the printer keeps moving up slowly, and the platform keeps moving up slowly, and the liquid resin within the printer gets cured from the light that's coming from underneath the vat, is what we call it. Right? They come in different types of platform sizes now, because the smaller the platform, the faster the print. So if we are just trying to print a single crown, we can use a different size of platform. We can use a bigger size if we are trying to do a bigger prosthesis or a bigger denture. And these printers now come in various cost structures as well. They are as cheap as $200-300, which is about 20,000 rupees for a printer. And they can go as expensive as 2-3 crore rupees per printer. But most of the good clinical in-office ones that we are using are in the range of 3 to 4 lakh rupees from an Indian standpoint. It's they have become approachable, still not very affordable, but they have become approachable, at least in their cost. The various companies. So this is something that we know that is coming up and is going to really be used on an everyday basis. So if you go to a dentist in 2-3 years, they should be printing the teeth and the appliances that are being used in your mouth. There are more expensive printers that are in the 40 to 50, even $1,000 range, right? So applications, at least from a dental standpoint, the applications that we have are plenty. We can just make models. We can make surgical guides. We can make temporary crowns, denture bases, denture teeth, removable prosthesis. This is an appliance that we use to make teeth with, used to make the bracket. When we are moving teeth, we put braces, the metal braces. To position those metal braces precisely, we use a printable appliance like this. It's called the indirect bonding tray, IBT tray. And a whole lot of other prostheses, including, I think this is the most recent one, where a full fixed upper denture can be 3D printed. And these are very, very recent, only about 6-month-old to 8-month-old US FDA approvals for these 3D printed materials to be used as final restorative material in these implantable implantable treatment that we do. So I think if we look at this from a more patient-centric standpoint, the making an appliance like this, making a full denture like this in India, because we make it in our lab in Nagpur, we know that it used to cost about 30 to 40,000 rupees, and at least 4 to 5 visits, appointments for the patient over a period of 2 months to 3 months to make teeth like this. Now that 2-3 month period has been reduced to about 5-6 hours, and the 40-50,000 has been reduced to about 2-3,000 rupees. So just because of that dynamic shift in the cost, now there's the equipment cost is still there, which I've not factored that in here, but from a material and a labor standpoint, the cost has gone down to about 1/10 of the actual cost of the material for the appliance to be made. And what that translates to is a lot more patients getting the treatment because the cost has gone down, and a lot more patients will be able to get very nice fixed teeth that they can eat throughout their life without having to worry about the removable denture, which is not the most comfortable prosthesis to use. So I always give an example. A removable denture is very similar to a cane. When you cannot walk, आप छड़ी दे देते हैं कि आप ये छड़ी लेके चलो ताकि घुटने पे प्रेशर कम आए. But up with the technology, we can actually change the knee or change the hip, and the problem of the knee joint which got worn down is over, and the patient can live a normal life back again. Very similar example of this in dentistry is a denture. When the patient loses all their teeth, we make them a denture, which is like a cane. It can do a little bit, but it's not the most comfortable thing for the patient to eat normal food. But with this technology, it was possible to do this treatment for the patient, but every jaw like this with the teeth and the implant in Nagpur was anywhere between say 2 to 5 lakh rupees for the patient to get all the teeth and the implant and the surgery done. Now the cost was high because the dentist had to pay a lot of money to get the raw material and to get the parts and to make the teeth. But with this technology, I think we can change that drastically and can provide a lot more care and a lot better care to a patient at a fairly affordable price. And I think not just affordable price, but also a much more precise surgery. Because of 3D printing, now what we can do is we can make these appliances where the surgery of the patient can be done with micron level precision. There are robots also nowadays that can be used to precisely place these implants. The robots are, again, that's one more area of technology that if anybody is interested in robotics, would love to get involved and help in a project that's making a robot that will help dentists to execute dentistry. There is a company out of Florida called Neosis, Neosis, that makes a dental robot called Yomi, Yomi, which right now the robot is about 2 crore rupees. So it's not affordable for a lot of dentists, but there are a few other companies that are working on making robots which are a lot more affordable. And when these robots come in, I think we'll be able to do these surgeries or these procedures a lot more precisely, at a fraction of a cost and fraction of trauma as well. When we have to cut or do smaller procedures in the patient's mouth, the patient compliance is better and we get a better outcome from our surgeries. So these are some other examples of custom or dental implants and appliances that we are making on a routine basis for patients. Like I was just showing you, this is an example of the same type of prosthesis that you see here. We can reconstruct complete faces and cranium or eye or nose or jaw using the technology that we are currently having at our disposal. And this is going to get better and better only, and not the other things that we make is just implant prostheses like I showed you. Night guards are something that that were made, but now can be made very easily in less than 15 minutes. So what is a night guard? It is a very simple appliance that we wear so that our teeth don't grind against each other. Normally, even every time you swallow, try to swallow, it's impossible to swallow without hitting the teeth. So every time we swallow, we are hitting and we are grinding our teeth. We are doing this at night, we're doing this during the day. So even when we are not chewing, even when we are not actively eating something, we are still grinding our teeth. This grinding slowly causes our teeth to wear down over time. And these appliances right here can be used so that this grinding action can be reduced at least by a third. Because if you wear these appliances at night, we can reduce the grinding that's happening at least for 1/3 of the time, and our teeth will last longer. So if our teeth were to come out at the age of say 55 or 60 or 65, because losing of teeth is a normal aging phenomena. Now, these are some preventive measures that we can do using very simple 3D printed technology that will help us not to give new teeth, but to save the old teeth that that we have as individuals or as patients. So, and like Dr. Rathi was mentioning uh, about more implantable devices being done, because the acquisition of data, the acquisition of data that we have using a 3D computer tomography machine, CT scan machine, we can really be uh, very precise and accurate in our surgery. And this treatment has become from a super specialty to a specialty treatment. Initially, say about 10 years ago, these implants or this treatment was done by a specialist dentist, by either an oral surgeon or by either a periodontist, not by a general dentist, because general dentists were not trained enough uh, to manage such procedures. And the training also, uh, they were not trained enough, and the technology that was present was very rudimentary. So the surgeon had to know everything to start the procedure. But now we can know 90% of the things with the diagnostic images. So a more general dentist who's not very surgically trained also can pick 40 to 50 to 60% of the more straightforward cases and only have the specialist do the more complex cases. So I think what this technology has done for us as clinicians is made this treatment simpler for the doctor also to execute, and we can pick and choose the right case and not uh, try to refer every patient out to a specialist. So the specialist only does the complex cases, and the general dentist can do the general or the more straightforward cases because of this. We can actually, like I said, we can actually 3D print models, and we do this routinely. We can 3D print model, uh, assess the anatomy of the patient before even we do the surgery. 8-10 years ago, this was just a thought, but now we are doing it on a regular basis where we 3D print these models. And uh, I think there is a lot of scope in this. Like I was saying, the scope lies in four different in three different verticals. From an engineering standpoint, there is software development that can be done. It could be using AI or could be using just the regular softwares that we have at hand, but more geared towards applying it in a very simple way for dentistry and making dental appliances and prostheses. The second is, I think, a development in hardware, where can we make 3D printers more geared towards, say, specific appliances, or 3D printers that are so easy to use and so uh, simple that we can put it in every dental clinic. And then I think the last amount of research is really required on the material side as well, where can we have material which is better than the current material, uh, and can we have that applied to our patient care directly? So hopefully this presentation was useful. Uh, I can open the we can open the floor for for discussion, or I can share a couple of really clinical cases uh, that that we can that I can share that we've done using this technology. Uh, so do we want to open the floor for some questions, or do we have enough time?
Thank you, Dr. Harish Rathi, sir, and Dr. Nagpur Rathi, sir, for such a captivating and insightful session. Your deep dive into the development of newer medical system for dental implant has provided us with a fresh perspective on how technological innovations are transforming the field of dentistry. The clarity with which you explain the concepts and your passion for advancing the healthcare system have truly inspired us. Now, we open the floor for questions and discussion. If any participant have any queries or would like to share their thoughts about the session, please feel free to ask, or you can either raise your hand or posting your question into the chat box.
There is a question from Muthu Kumar V. How can we do animal test before fitting implant?
So right now there are ways to do animal testing. So the animal testing is done mainly for the material compatibility. So material compatibility testing is generally done from a design standpoint. Most of our body behaves like the body of an animal. So from a design standpoint and from a fabrication standpoint, there's no animal testing needed. The animal testing is mainly needed for material biocompatibility testing. And when we develop a new material, there are standard protocols. I think VNIT in Nagpur, there are resources to do that. There are resources to do material biocompatibility testing in a lot of other places in India. So it's not something that we cannot do. It's at least from a dental standpoint, this is a problem which is very solvable. I hope that answered the question. Why ethical committee approval is required? Ethical committee approval would be required. Yes, it depends on the institute and the kind of and the level of invasiveness that we have for the test. But say an example would be if we are developed. So ethical committee approval, I think, is more of a institutional question. Unless we are really hurting or harming anybody, I don't see a reason why we shouldn't be able to get ethical committee approval. These are we are building on existing technology. in the most part, and not really uh, building base level or how do you call it? We are not really making very basic science, doing any basic science research. It is more of applied research and applied studies. So ethical committee approval should not be very hard. Um, so I think it's upon the institution. I think Lata Mangeshkar also, we've done a few projects with them in the past, and they have a fairly good um, ethical committee that does help projects to move in a good direction fairly quickly.
I think the participant got the answer. What is the life of 3D printed implant?
That's a good question, because uh, so it depends. Actually, it depends on the type of implant. If it's an actual implanted device, which means that if it is going inside the patient's body, uh, generally the life uh, is or should be more than the life of the patient, at least in dentistry. Uh, and we have been able to achieve that very easily uh, with printable metals like printable titanium. There's titanium printing that can happen very, I won't say easily. They're expensive machines, but the machines exist. I know of at least 2 machines in Nagpur that do titanium printing. So, titanium printing can be done, and then when the printed titanium prosthetics or implants are made, they should last for the lifetime of the patient. When these prints are done with resin material, they have a life. Resin will generally wear down in about 5 to 7 years, and we have to replace the prosthesis in about 5, 7, or 10 years once the wear of the appliance or of the device happens beyond the use of good function. So twofold. If it's metal, generally it's for life of the patient, and it will outlive the patient. If it's a resin or composite based material, there is an expiration date beyond which these appliances have to be remade and replaced. What is the approximate cost of titanium printing? Titanium printing, sir, I think it's printed based on the cost is dependent per kilogram of printing of power of the material. Like I'll give you an example. The bare cost of titanium printing of an appliance, which is probably this big, is between 10 and 15,000 rupees. So is it very cheap right now? It's not very cheap, but it used to be about 2-3 lakh rupees. So it has come down significantly. I could not read the full question. Let me actually try to open. Which material is preferred for mandibular implants, polymer or titanium? Is it coated or not? Please clarify. So it depends. Like I said, if it's implanted inside the jawbone, generally it is metal. And generally it is metal. And yes, these are coated post printing. There is sandblasting and acid etching that's done generally. There are different coatings also that have been tested, where we apply hydroxyapatite or we apply some calcium phosphate on top of the material, so the osseo integration or the bio integration of the material is better. But if the appliance is going on top of the body and it's not within the body, then it's generally polymer that's used. Hope that answered the question. As far as surgery is concerned, which one is easier? I I don't know whether I would call any of these surgeries. They're both fairly easy. None of the surgeries are hard, sir. This is so implants in general. The regular implants have become an everyday procedure for most dental surgeons. So if it is say within the mouth implant, upper jaw or lower jaw, both are doable and both are not difficult. Um, Generally, the limiting factor of these surgeries is the amount of remaining bone of the patient. So when we lose our teeth, the bone that is holding the teeth also slowly resorbs away, it shrinks away. Like actually you can see in this picture, right? If you can look at the screen, you see the bone width in different areas of this. So this was the patient before extraction. This is the patient after extraction. And you can see the bone width in different areas is different. This is based on the amount of bone that's underneath the gum of this patient. And uh, when uh, when there is less bone, the implants become difficult, whether it's the upper jaw or the lower jaw. When there is enough bone, the implant is pretty straightforward in either of the jaw. So uh, what precautions are required for removal type of teeth implants when someone uses it? Uh, from a patient use standpoint, sir, the precautions are the same as 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 even older dentures that we used to make. You generally want to remove the denture every night. You want to clean the denture every night, and then rinse it out with some sort of a disinfectant solution. So, um, so it's not anything different from the older dental appliances that we were making, whether it's 3D printed or the older ones. The precautions remain the same. Dr. Muthukumar asked, what test is needed for dental implants? What analysis is to be done? And how much load is considered for analysis? From for dental implants, generally, our mean occlusal force, the amount of force that we generate during our chewing is about 150 to 300 pounds uh, per square inch is what the so most of these materials are tested to 3 to 5 times beyond this number. Uh, Now basic testing can be done with FEA modeling. Eventual testing, we do need some sort of mechanical testing unit like Instron or those kind of machines that you use in your engineering testing regularly to consider what uh, is a good uh, strength capacity of these. A lot of the implants that we make, especially when they're made with titanium or with some sort of a metal, uh, they are generally made uh, more stronger than what the mean numbers are. So individual implant testing is generally not done. It's done for just one unit per batch, and when they are custom made, they're just made a little more. They're over engineered for their strength. Is what uh, is what most people end up doing. But there is enough research and enough data and enough scientific material that we can follow, sir, to evaluate how much mechanical and how much uh, mechanical force is going to be on these appliances, and we can use those numbers from literature to kind of base our testing on. Uh, Thank you. Thank you so much.
Thank you. I think all questions are over and all getting correct information. And so, dear participants, I want to tell you that Dr. Nakul Rathi, he joined this session from Houston, USA. So I think it's early morning in USA. So we are very much thankful to Dr. Harish Rathi sir and Dr. Nakul Rathi sir, so that you took an interest and initiative uh, to join this session and for giving such a valuable, precious information in terms of dental implant and concerned with the 3D printing.
Thank you.
So, yeah,
Sir,
I think over to,
I've also put in my email address and my
yeah, you can see,
and
yeah, it's,
Brad's email address in the chat list. And if anybody wants to uh, kind of learn more, do more things, or collaborate with us, we'll be happy to see what more things we can do.
yeah.
After
So
this
there's a
session.
question from Anil Sahu, sir. Please provide your office address. So Dr. Anil Sahu, Dr. Harish Rathi, who is the father of Dr. Rathi, sir. So they are having advanced dental clinic at Ramdaspet Hospital. They are having the hospital just beside the Midas Hospital. Okay. So you can contact with Dr. Harish Rathi, sir. We are already in touch with Harish Rathi since so many years for discussion of various case studies and giving the kind of solution. As we are also concerned with the mimic, and they used to give us the various case study what we can do from our engineering point of view. So really, I'm very thankful to Harish Rathi sir also. As I told them, then he took initiative and asked Nakul sir to join the session. So thank you. Now over to Nilesh Nirvan sir for vote of thanks.
Thank you all the participants for your thought-provoking questions, and thank you Dr. Rathi sir for your detailed and enlightening responses. This interactive discussion has further enriched our understanding of the subject. Now, with that, we conclude our technical session 9 on development of newer medical system for dental implants. On the behalf of the organizing committee, I extend our sincere gratitude to Dr. Harish Rathi and his son, Dr. Nakul Rathi, for sharing his valuable expertise and insight with us today. We hope this session has inspired you to explore the exciting developments and future possibilities in the field of medical system for dental implants. Thank you, sir. Thank you very much.
Yeah, and I want to add one thing, because dear participants, we had earlier sessions from Dr. Ashutosh Bagde, then Dr. Sandeep Dahake. So, but they were engineers and they are working in the biomedical applications. Now, don't get confused. Dr. Harish Rathi and Dr. Sanjeev Rathi sir, they are the dental surgeons. Okay, so they are the dentists. So we have, whenever we design this program, then we also think that there must be some participation from the real dentist or dental surgeon. Okay, so that's why this is the kind of input from a doctors, and earlier in sessions like it was the input by the engineers. So definitely it would be a great collaborative things which we can do in terms of either dental or any anatomical implant or like that. So
So
thank you.
actually, Abhay sir, thank you for mentioning that. Also, just to add to that, so Dr. Ashutosh Bagde, now he's in
Ah,
Varda. When he was a
correct.
student at Raisoni and then at VNIT during his PhD time, we were working very closely. I had just graduated from my master's, and what I saw in the US in my studies here, there's a very close collaboration between the medical profession and the engineering profession, uh, because even the simplest thing that we use, even if we are using a blade to make a cut during our surgery, the blade is designed and made by an engineer, right? So everything that we do in healthcare has an engineering background to it, and with the new technology now, there's a need for more collaborative work in India as well. Just a small example, my dental college in Ohio, where I studied for my master's, the engineering college was the next building. Mechanical engineering, the chemical engineering college was the next building. So the collaboration was very easy. Whereas in India or in Nagpur, government dental college is in one area, Raisoni is in one area. So collaboration, we have to take a little extra effort to make that collaboration happen. But when these collaborations happen, I think really good output comes out.
So that's why, yeah, same, no doubt. As you said that even Rathi sir clinic is in Ahmedabad, but the distance doesn't matter.
Doesn't matter.
When
Yes.
such kind of initiative taken by Dr. Harish Rathi sir, very dynamic, really very dynamic, sir. You are, every time whenever we ask him, sir, when we can meet, he said, come today, no problem. And we used to associate it with that Mr. Ashutosh. He is also mechanical engineer working in Advanced Dental Hospital. So I also appreciate his knowledge that how and आशुतोष बागड़े सर का जो प्रेजेंटेशन था वो सर्जिकल गाइड्स के ऊपर में ही था. So obviously, so the things this is very kind of a lesson to all the listeners also, because there are so many questions from Dr. Muthu Kumar. I have seen every day he is asking questions. So definitely this is spreading somewhere a good message. So everybody can do this. Not only Raisuni we can do. So thank you. Thank you very
Thank you,
much
sir. Thank you
for
so much.
giving your. I'm very sorry that early morning you have to wake up and prepare for the things.
Yes, my pleasure.
Yeah,
My pleasure.
Harish sir, Rathi sir, thank you.
Thank you, sir. Thank you. Lot of thanks. But yeah, we got a good opportunity to speak to you people, all the stalwarts and PhD people in 3D printing technology.
Thank you.
Yeah, thank you.
Thank you so much.
Okay, and message for participants. Now there is a 8 minutes break. Okay, next session will be by Dr. Varun Khandelwal. He is again a dental surgeon. Okay, and we are associated with Dr. Varun Khandelwal again from Harish Rathi sir, because once he has given his number and he is also doing well. Okay, so the next session is from them. So we will meet after around 8 minutes. Okay, thank you.